Thank you so much, sir and ma'am. Now we request our distinguished chief guest, Dr. Rohini Karunakaran ma'am, to address the gathering.
No, Kumar. Vela. Pretty good.
ஒரு பக்கம் விடலாமா? சரி பிடி ஒரே பக்கம்.
Check.
Good morning. I hope my voice is okay. Sorry, I just landed and I was having severe cold managing, and I'm very happy to be here in SRM campus, one of the best and esteemed institutions in the world. So thank you for inviting me here. Thanks to our principal sir, our director, and all of them, and Dr. Sharon for inviting me to be here today in this international conference. So I'm sure all of us have seen Iron Man. We've seen the movie, we know the hero. But do you understand why it is here? Do you know that the suit that the Iron Man used is a nanotechnology suit? How many of you knew about it? What does it contain? When you say nanotechnology, it's still an old topic. We're all talking about artificial intelligence here today. But nanotechnology with artificial intelligence will be another boon. However, nanotechnology has one of the most important and promising one for drug targeting and for health trends. So that is your topic of today. You're talking about human health. You're talking about biological sciences and human health. So as you see the Iron Man suit, it's a complete nanotech integration. And of course, it's a nanoparticle redirection with gold nanoparticles. When we say nanoparticles, the first thing that comes to our mind is gold, silver, and titanium nanoparticles, because those are involved in treating and for drug targeting in the human health. So my topic here is nanotechnology revolutionizing healthcare. So I'm Dr. Rohini Karnagaran. We have done a lot of research on nanotechnology in our university. We have done on antimicrobial efficacy of nano-coated silver nanoparticles against selective pathogens. This was in collaboration with the Serum company with Malaysia. So we had this, of course it was in 2012 where we had a number of sampling planning for medical devices involving silver nanotechnology. And now we have moved into the next phase where we are using natural products coated with nanoparticles like silver nanoparticles, and we have applied for grants for treating triple negative breast cancer. So that is where we have moved up to nanoparticles, because nanoparticles is the talk of the day. When you say nanoparticles, the less is more. That is the quote as it goes for nanotechnology. Now when we are talking about artificial intelligence, why again nanotechnology? A recent study, a technology and innovation report by the World Health Organization has quoted that in the recent decades with the frontier of technologies, we only have artificial intelligence, robotics, biotechnology and nanotechnology that's going to be in the boon. It's not just billions, it's going to be in trillions, which is focused, in which nanotechnology plays a very important role. And this report tells out how nanotechnology, the publications, the patenting, and how it would be in trillions when it moves up to 2025. So robotics, biotechnology, nanotechnology with artificial intelligence will take the world to the next level, which is going to be for the human health, for the treatment of human health, for diagnosis, as well as for all the other conditions related with human health. So nanotechnology, just going back to the students, nano is a word that is being used, which is nothing but dwarf. In Greek, it is called as dwarf, and nano is nothing but tiny things. So basically when it comes to nanotechnology, the less is more, as you quote, and it's also about bigger isn't always better. That is what it comes for nanotechnology. So nanoscience is about the science of tiny things that you talk, the dwarf things, the tiny and the tinier. So talking about nanotechnology with digital frontiers, so tiny is tinier, nanotechnology is those that we talk about with that of nanoscale of 1 to 100 nanometer per scale. So that is why nanotechnology is more efficient, because you're talking about manufacturing smaller objects in smaller scales for treatment, for diagnosis and treatment in human health. And nanotechnology is used in a wide range of products. Even natural products are being used, which is integrated with nanotechnology, which is used for the treatment in human health. Taking you back to the origin of why this nanotechnology, it was this American physicist, who is Richard Feynman, who is called as the father of nanotechnology, who said there is plenty of room at the bottom. So what does it mean? At smallest, a tiniest thing which can be used to treat and diagnose a lot of things in this world. So it is Richard Feynman who mentioned that the field of nanomedicine applying to a nanotechnology, a nanoparticle, a tinier one, can change and revolutionize the world through medicine. So talking about a bit of chemistry, not much into the chemistry, but then to remember why nanotechnology, how can that tiny element can treat and do medical miracles. So nanotechnology talks about the basic properties, which is surface, the physical, chemical and biological properties. Now what does it do? because of the size, shape, and the elasticity, the material that is used, the silver nanoparticle, the gold nanoparticle, the tinier properties of these have a very huge value in targeting the drug, in diagnosing, in treatment, and a lot of activities. So nanomaterials are very important because of intrinsic properties, and that is why this is being used in medicine, in healthcare, and various other diagnostic conditions. So nanoparticles are very specific. As I mentioned earlier, there are different nanoparticles that is available, varying from 1 to 100 nanometer. Their surface area, the volume ratio is what which determines it. And it absorbs a large amount of medications which can move quickly, which can target into the bloodstream. And the recent one is it can even cross a blood-brain barrier and use for the treatment in medicine. So nanoparticles have very good capability, and depending on the effectiveness, each of them is involved in various diagnostic and therapeutic functions. Well, why in medicine? We've been talking about nanotechnology. It's been used in industries, it's been used in many other polymers and other conditions. However, in medicine, there are new technologies. Why? Because there's, as we know, there's been COVID, we have been talking about vaccine, PCR, and lot. Even a normal layman would know about a PCR. Even a normal layman would know about diabetes. Everybody in the home, at least one person is diabetic. My father and my mom is diabetic. So we all know, we all have people with diabetes. But why is nanotechnology into it? You have a smartwatch which tells you about glucose monitoring. That is nanotechnology. You talk about lenses with glucose detection. That is nanotechnology. So nanotechnology is there in every part of our life because that is integrated. So nanotechnology is involved in translating the breakthroughs in medicine. It is helping us to design more and more, identifying from the bottom, from the tiniest part to help involve in diagnosis, and helps to find more benefits with healthcare and create technologies which can also improve our country's economic growth. So talking about healthcare in detail, like currently what are we using it for? We have a lot of nano-based wearables that we are using in current healthcare. It's used in a number of diagnostics. We have nanorobotics which is being used in surgeries, and we have done successful surgeries around the world. And nanomedicine used in the treatment of various conditions. We have nanorobotics, tissue engineering, and drug delivery. Targeting the drug delivery system is one of the achievements in nanotechnology. So these are most important one which is commercially used in medicine and is used in various parts in human health for treatment and diagnosis. So these are some of the potential applications of various nano devices that is being used. Like example, nanoparticles are being used by targeting drug delivery. Nanoshells are used in tumor specific signaling. Nanowires are used in high throughput screening. We're doing a lot of drug discoveries, identifying the drug targets using nanotechnology. And these nanostructures, based on the structure, you can use them for its application in health sector. Example, nanofilms can be used in biological, chemical, and nanosensors, biosensors. All the glucose monitoring machines are all biosensors that we are using in a day-to-day life. And dendrimides are used in diagnostic applications for antibacterial agents. Quantum dots are used in vivo bioimaging, which is used for RNA interference. So there's a lot of nanoparticles that is being used in day-to-day, both for research purposes as well as for a day-to-day life. So nanosystem applications in healthcare. So this various applications based on the size and their functions, they've been used in gene therapy. A lot of studies with gene therapy has been used in applications in healthcare. We have drug delivery. Cancer therapy is one of the most prominent one with nanotechnology because cancer treatments are done through nanotechnology. We have genetic disorders, identifying genetic disorders. It's identifying before it comes up. So genetic identification is done earlier. Ocular diseases could be identified. We have monitoring machines and nanotechnology which is inserted into the eye, which can detect the glucose levels and other monitoring conditions. And we can be used for detecting cardiovascular diseases, and it can also cross the blood-brain barrier and cause central nervous system disorders. So these are some of the bio-integrated sensors that are potential, and it's being used for clinical testing. Wearable electronics, as I mentioned, on-body sensors, the sensors that you can use as watch or any other tattoos that can be used. Smart pills, all these are nanotechnology, which is used in regular identification as well as for monitoring for diagnostic and therapeutic applications. So nanomedicine is nothing but the medical applications of nanotechnology, which is basically to cure diseases. Identifying, diagnosing, and curing diseases is a major target in human health. So nanomedicine is main thing which is helping us in repairing the damaged tissues and also protect the human health. So in medicine, nanotechnology is used as biological imaging in medical diagnostics. It is used in advanced drug delivery systems. It's used as biosensors for a number of airborne chemicals or other toxins. And one of the recent and the more prominent one is the regenerative medicine. And biomedicine, bio-nanotechnology is more durable and rejection resistant artificial tissues and organs. Nanosciences is also involved in a number of molecular studies. We are all doing a lot of research in molecular studies, and nanosciences are involved in identifying, facilitating molecular recognition, which is a main one, self-assembly motifs, as well as in the assessment of these processes, which can help us in the targeting the drug delivery system. So one of the most prominent thing about genetic disorders is identifying at early and accurate conditions. So early and accurate diagnosis by nanotechnology is very prominent, especially in genetic engineering and targeting drug delivery on the spot, be able to target the site and monitor its impact, and also to identify the conditions with regenerative medicine, stimulate repair and treat the organs. And the most important thing is nanotechnology is a number of infectious diseases, cardiovascular diseases, Alzheimer's, Parkinsonism, all these can be detected earlier using nanotechnology. Currently, that is one of the prominent things today, and analyzing them earlier at an early stage and treating them earlier is a main challenge, and nanotechnology helps us to do that by identifying them, monitoring them, and getting an early prevention so that it can be cured. And one of the other important thing with nanotechnology is the treatment of cancer. Nanotechnology is traditionally used for treating cancer by using targeting drug delivery systems, which is the most prominent one in cancer biology. And nanodiagnostics, screening, as I mentioned earlier, screening for early accurate results for risk factors and also predicting the risk factors at an earlier rate, because nanotechnology involves more sensitive, faster diagnostic conditions which can help in the diagnosis of asymptomatic patients. We do not know a person has a cardiovascular condition. However, nanotechnology involving robotics and medical imaging can help us identify conditions at an earlier stage. And as mentioned earlier in genetic screening, it can be involved, it's a high sensitive one which is involved in detection of early biomarkers. It is a non-invasive, painless technology, which is a diagnostic one, which involves identifying the genetic testing in an individual, therapy selection. Like we can identify all the syndromes and conditions which can be done earlier to prevent conditions earlier so that it could be treated or could be modified. And drug delivery is one common thing, protected drug delivery to the target size using specific nanoparticles, higher dosage, healthy tissue is not affected, unlike conditions in other cancer biology where it also, nanotechnology also protects the health tissues and helps in screening. And theranostics is one important thing, which is a combination of one radioactive drug to identify, which is to diagnose, and also involve in a second radioactive drug therapy, which is also used to treat. So this helps in protecting the healthy cells and also destroying the cancer cells. So that is one important thing about targeted drug delivery in nanotechnology. And regenerative medicine is a new one which is continuously progressing and helping with the human health. So regenerative medicine is nothing but the process of replacing or regenerating the human cells or tissues to restore and establish its normal function, which is quite challenging, especially in conditions of cancer and other conditions where it is infectious conditions. So regenerative medicine is the one which will be targeted cell implantation, biomimicking the cell membrane, which will enable to get restore the normal cells to function in a normal way. Polymers with programmable conformation and control of implanted rejections can be identified. So all these involves nanotechnology, which is a very important thing with regenerative medicine and for the treatment in human health. So as mentioned earlier, in cancer cells, nanoshells can be used as a metallic outer layer and silica core, which can be used for treating and killing the cancer cells in the body, which is a very important thing with nanotechnology in human health. Targeted drug discovery, nanoparticles contain drugs. As mentioned earlier, they release directly into the targeted cells, so they enable us to treat and help in the drug targeting system. It helps to pass through the blood-brain barrier. It is quite a challenging thing when it crosses a blood-brain barrier. Nanotechnology, which is intelligent biosynthetic nanomaterial, nanobiomaterial, IBN materials can cross a blood-brain barrier, which is a very important thing, which can help in the treatment of only the infected area that requires treatment and protect the human health. And nanobiotics, as mentioned earlier, it offers superior alternative for the existing treatments, as it can help with the treatment and also with the molecular structure of the drugs, enable you to treat the patients with minimal painless conditions and also diagnostically. And drug resistant, we use a lot of antibiotics. Antimicrobial drug resistant has been a common thing even today. So the treatment of multi-drug resistant bacterial infection, which is quite a challenge in medicine, is being ruled out with nanoparticles. Nanoparticles can overcome the drug resistance. So the treatment through nanoparticles is very positive and overcoming when compared to multi-drug resistant bacterial infections. And this is a novel mean for treatment for antibiotics, which does not respond to the conventional antibiotic treatment. And as we all know, nanoparticles involving gold, silver, titanium. We have done a lot of studies involving silver nanoparticles, which is involved in killing virus cells and cancer cells. And these are very important because they reach into the nucleus of the germ, while the viral gene pool is located, and the germ cannot replicate. So it makes sure the oligodynamic silver particle kills the virus, makes sure it's a powerful one to prevent the virus replication and to kill the germ cells. Another important thing is about stopping the bacterial infection without antibiotics. As I mentioned earlier, multi-drug resistant nanoengineering is a very important thing which could prevent the bacterial infections using biochemical machine nanofactories, which can basically kill the germs, confusing the bacteria and stop them from spreading without the use of antibiotics, which can protect the health, which can prevent further other side effects in the human body. It can also, moving into the next level of human health, is robotics, sensoring and cure sensor. So nanofactories involve bacterial infection can be stopped. The bacterial replication could be stopped by triggering the bacteria, by preventing the other cells from being damaged and killing the bacterial cells without causing any harm. So nanotechnology has been used frequently, more effectively in the diagnosis, detection, diagnosis and the treatment of diseases, and we are using lab chips nowadays, labs on chips, detection of diagnosis of diseases, which is more efficient, and it's also involving nanowire and other chips, which is for the early detection of cancer biomarkers. And in cancer study at molecular level, they are also involved in identifying the gene mutation and the cause of cancer at the early diagnosis, which is very important, and gene expression pattern for the same cancer could be identified, and personalized to provide the gene and genetic information could be identified, and personalized medicine could be done for treatment to every specific individual rather than a random treatment for every individual. And human genome, personalized medicine, regenerative medicine and personalized medicine is a tool today, and nanotechnology plays a very important role to identify the molecular changes of genes that could be identified causing high risk of cancer, precise diagnosis of special types of cancer, proactive cancer management which can be done by earlier detection, give them lifestyle modification and can be treated, pharmacogenomic profiling which can be done for drug treatment and drug responses targeting the drug, and also for gene therapy which involves both in vivo and in vitro gene therapy which can prevent various other diseases. Some of the common ones that we're using for monitoring day-to-day life in our health is the glucose monitoring. As I mentioned, every one person in our home is diabetic. The commonest one that we use today is identifying using biosensor. Biosensor is a nanotechnology one. The smart watches that we use is nanotechnology. The gene chip layout which is used for identifying and used as scanners is very important when it comes to biosensors. Immunosensors involving the antibiotics, antibodies that can react to the reagent to recognize and bind the target sites are used for the day-to-day analysis or monitoring of conditions. The glucose watch that you're using is a non-invasive transcutaneous glucose measurement, which gives you the values, which enables you to identify whether you're hypoglycemic or hyperglycemic, so that it can be done for treatment immediately. So glucose watch is a nanotechnological one, which involves reverse ionophoresis principle, enables you to identify, because of the glucose molecules reacts with the smartwatch, the sensors, the biosensor enable you to identify the levels of glucose in the body, which continuously monitors the patient's glucose levels. You also have smart tattoos by nanotechnology, which is by biosensing, which is incorporated onto the microsurface layer, which is again fluorescent changes enables you to monitor the levels of glucose binding protein, enabling you to understand the level of glucose in the body and for treatment purposes. We have quantum dots, which are colloidal semiconductor nanocrystals, which are also used for various conditions, identifying them, used as a characteristic one for identifying and monitoring. Nanorobotics are used in a lot in surgery, and currently we are using nanorobots, which is designed to perform a specific task because the precision at nanoscale is very unique. So it is within dimensions of few nanometers or less, which enables you to perform all the work at molecular as well as cellular level, and it's used in medical and industrial fields. So nanorobotics involves identifying, it can even identify the protein, flow with their RBCs, maintain the glucose levels, signal them, and you can even have it as an app which enables you to identify the levels of sugar and other components in your body. You can use it for any levels which can be used. You have an app and it always gives you the levels if it's hyper or hypo, so that immediate diagnostic treatment can be provided. And the commonest one which we use is a glucose biosensor, as I mentioned earlier. We also have subdermal implants. We have contact lenses and nanotechnology which can be used for treatment, where it is implanted into the, okay. So one is in the skin fluids, which can be implanted on the skin, which can use as a sensor, and it can be used to identify. Smart lenses, contact lenses, which can be used to identify from the tear fluid, which will detect the amount of glucose in the body. So this can also be a part of your regular monitoring devices. GlucoTrack, as I mentioned earlier, it's an electromagnetic and heat capacity, which enables you to have it as a ear clip, help you to monitor the levels of glucose in the body. And other ecotherapeutics which can be used to identify, and each of them have a lifespan which can be regularly used for a day-to-day life to monitor and detect the conditions. And you also have tattoos, you have sweat extractions. Even the sweat, you can identify the levels of glucose, you can identify the levels of the components which can directly be detected and sent, and you can analyze them based on the sweat sensors. And you also have microneedles in the diabetes conditions. It can be used as sensors and used in the treatment, the microneedles which can detect the levels of glucose for the patients. And saliva, sweat, saliva, all these can be used as a main important component, where sampling technology by saliva you can identify the levels of glucose in the body, which can be used for monitoring the levels of glucose in the body. As I mentioned earlier, the tear, the glucose sensor under the lower eyelid which can be used. These are sensors which can read the levels of glucose in the body, which enables you to identify the levels of glucose for the patient, and it can be monitored. So talking about nanotechnology, to summarize, they have a number of clinical applications. Why nanotechnology? Because of their sensitivity, speed, and flexibility. Tiny matters a lot. The less is more. That is a code for nanotechnology. Nanotechnology particles can be used in a number of activities and in substances, enabling to have small sample of volumes which give you perfect results with a sensitive results that is required for treatment and diagnosis. So many of the technologies involve both in molecular as well as in cellular level, which can be used for treatment. And currently, Parkinsonism, Alzheimer's, cardiovascular diseases, all these involve nanotechnology treatment, which is quite effective and positive when it comes to treatment of these most important prominent diseases. And nanotechnology has been making a positive impact in both clinical decision making and in treatment costs. Nanorobotic surgeries have been very positive in the treatment of various conditions. And nanotechnology involving targeted drug delivery is a very important tool which is involved in diagnostics and therapeutics and in various other therapies which can be identified. Nanobiotechnology is used in personalized medicine, which is used as specific therapeutics for the individual. And the nanotechnology is a diagnostic application, is of a great promise, not just in clinical, but in all the fields and most prominently in the treatment for human health. So, of course, anything that has been used in human health must have ethical issues, must go through the ethical concerns. Of course, nanoparticles being smaller, tinier to tinier, is used in various other fields and have quite a positive results and promising results. However, we need to be very careful when it comes to concerns of nanoparticles. Experts say that more the bioreactive particle, it could be toxic. So depending on the silver, the gold or the titanium nanoparticle that is being used, it has to be very clear that the ability to interact with the other living system, it increases. So we should make sure that various levels of ethical clearances are done before it's done for a human health treatment. So basically it has the ability to interact with other living system. It can cross through the skin, lung, blood-brain barrier and so on. So we must make sure that chemical reactions are studied very well when it comes to nanotechnology. So there are some concerns when it comes to nanotechnology. So the safety is, as we know, everything has been, like we see in movies, we see in the mobile, everything is in the mobile, everything could be hacked. That's the same thing that goes. So we must make sure the nanotechnology and the possibilities are not limitless. However, it should be understood, the challenges should be read properly, and managing the potential safety and health risks should be understood. So the National Institute of Occupational Safety and Health remains committed to protecting the workers' use of all these nanotechnology and things that is used for human health have to be under ethical considerations before it's being used on human health. So the future challenges, nanotechnology with artificial intelligence could make the human life miracles. However, the most important challenge that we have is the size, the tinier to tinier, the size, the remote operation because of the tiny particle, the nanoparticle from 1 to 100, the reliability, the sensitivity of it, the accuracy of detection, the sample handling, telemetry and the range of analytes. All this make a very future important challenge in nanotechnology. With all these being ruled out, this could be the next one. This could be the main one and the promising one with artificial intelligence in 2025, which is just nearing, and we could have trillion lot of articles, publication and patents with nanotechnology. Thank you.
Thank you, ma'am, for your enlightening speech. Your words have surely sparked our imagination and ignited a passion for exploring new frontiers. We have about 10 minutes for the question and answer session. Please raise your hand if you have any question for the discussion.
Good morning, ma'am. Nice presentation, ma'am. Ma'am, one question is, you told everything nanoparticles are more advantageous one. In future, there is any disadvantages?
Definitely there are challenges because as I mentioned, the tinier the tiny particle, we do have a number of technologies like what we are using for the smartwatch and everything is fine, provided based on the sensitivity and accuracy we are using nanoparticle. However, there are challenges because the tinier the thing, the nanoparticle can cause sensitive reactions for some people. It need not be for the all. So the sensitivity must be studied, and depending on the target action, it has to be studied. Example, if it's a drug delivery or treatment for cancer, depending on example, the study which we are doing right now is on a plant extract with silver nanoparticle coated on it for triple negative breast cancer. So depending on the cancer, depending on the targeted drug delivery, it has to be tested before it's on a human health. So it does have a number of challenges. As I mentioned, it could be because of the remote operation, the size, accuracy, sensitivity. It could be quite challenging.
Yes, ma'am. I'm from botany department. There is any medicine we can prepare?
You can do. There are a lot of natural products now used along with silver nanoparticles and gold nanoparticles which can be involved in drug targeting. We can do a number of spectrometric analysis which you can use it and take it to the next level of research where you can identify using nanoparticles with natural products.
Natural.
natural products. We do have a number of research.
Thank you.
Guys, is there any question to ask to ma'am? Yeah, please give the mic to her, ma'am.
Morning.
Yeah, this is Nagamani from college. So I have a doubt that
Yeah, I think
told me that nanoparticles can penetrate to the CVD.
yes,
Can we quote any neurotransmitters onto the nanoparticles?
yes, yes. The study is on. The physiological and the biochemical reactions are being studied that it can cross the blood-brain barrier, because blood-brain barrier, crossing the blood-brain barrier could be a fatal condition, as we all know. So that treatment has already been initiated, and nanotechnology, because it's a tinier one, it can diffuse and it can have a physiological function. That is why nanotechnology is more prominent with treatment of Parkinsonism and Alzheimer's right now. So earlier detection would be very essential. At 40s, we can go for detection and identify not just for cancer, for all Alzheimer's and other Parkinsonism condition could be detected earlier using this. Yeah, research is still going on, but not done specifically on human health right now, but studies are quite prominent and promising with this treatment of Alzheimer's and Parkinsonism. Yes.
So I'm working on developing a after sensor for lithosphere. So I'm working in carbon nanotubes. So
Okay.
is there a chance that if we play with the chirality of the carbon nanotube, we can develop it into a colorimetric sensor? Like gold nanoparticle can be used for colorimetric approach based on the salt-based aggregation. So the pink to purple shade, the purple color shade. Is there a chance that we can do it with one-dimensional nanomaterial that is carbon nanotube?
Carbon nanotubes are most prominently used for this, but you might have to use a biosensor in addition to the carbon thing, because that is the one which is going to detect, and of course size has to be very sensitive when it comes to nanoparticle thing.
Yes, that sensing material aftermath that we are using.
Okay.
What it is, we can easily coat the aftermath onto gold nanoparticle and we can go for a colorimetric approach.
Yes.
But in case of carbon nanotube, we don't have a signal producing element there.
Okay.
Other than the nanomaterial. So that is the disadvantage. So I'm asking, is there
Maybe another layer of biosensor which could react with the what are you using it for?
detecting leptospira? It's a bacteria.
Okay, so you can use another coating which can identify the viral thing and do a drug target. You can move in for molecular docking studies, where you can use first do a dry lab where you can do a drug targeting using molecular docking technique. Are you aware of docking technique? It's about the protein-protein ligand. So you can do a docking technique, identify which will be prominently targeting, and then go in for the further one. That would be helpful. Go in for docking analysis.
So we cannot play with the nanomaterial at all for
No, you will have to do a docking to identify first and then move into it.
So guys, is there any question? Okay.
Thank you. Thank you for the questions. Thank you.
Thank you so much, ma'am. We appreciate your prompt response, ma'am. Thank you for getting back so soon, and thank you for providing the valuable information. Thank you all. We would like to call upon Dr. O.V. Ravi Kumar, Head Department of Microbiology, SRM Arts and Science College, to deliver the vote of thanks.
Vanakkam. Morning. Expressing gratitude is a highly ritual act. First, I would like to thank everyone for being here. We thank our management, director, principal, SRM Arts and Science College, and today's chief guest, Dr. Rogini Karunakaran, for her valuable keynote address about the conference and nanotechnology and its applications in human health. We would not be here without the hard work of the faculty members from life science department like microbiology, biochemistry and biotechnology. We thank our volunteers for their so hard work for the success of this conference. Last not the least, the today's key player of the event, the participants from the various colleges and universities, we welcome and thank you for this remarkable conference. While talking about the challenge, Dhoni says in Tamil, right? காலம் எப்போதும் உங்களுக்காக காத்திருக்காது. காலம் எப்போதும் உங்களுக்காக காத்திருக்காது. களம் உங்களுக்கானது. Today's kalam is for yours. Please do it. Thank you. நன்றி.
Thank you, sir. Before we proceed to the next interactive session, let's take a short tea break. It will be served outside the seminar hall. Please be
We will have a short break and then we will begin the next session. The tea will be served by 11:20 opposite to your registration desk. You can take this time for a break and then we will gather again for the next
ஏன் சார் இல்லை 50 தான் லாஸ்ட்டாக ஆயிரத்தி நினைக்கிறேன் சார் இது குடி சொல்ல லைட்டில் ஆஃப் பண்ணிடலாம் சார் இது கேட்குதா அப்படியே கனெக்ட் ஆகிட்டு இருக்குமா சார் ஆட்டோமேட்டிக்காக அங்கே இது பண்ணிட்டு வந்து வா கனெக்ட் ஆகிடுச்சு
Good afternoon all, ladies and gentlemen, welcome back to the session 2. And good afternoon to all the dignitaries, guests and delegates with a great joy and immense expectation. I feel privileged to extend my warm welcome to our guest speaker, Dr. K. Padmavati ma'am. We welcome you ma'am. I would like to call upon Dr. K. Abhirami, Assistant Professor, Department of Microbiology, SRM Watson Science College, to introduce our guest speaker.
Good afternoon, one and all present here. It is immense pleasure to introduce our distinguished guest speaker today, Dr. K. Padmavati. She currently holds the esteemed position of Associate Professor in Microbiology at Sri Balaji Dental College and Hospital, showcasing her commitment to the field in the healthcare and microbiology. Dr. Padmavati is a distinguished scholar with a PhD in medical microbiology from Dr. ALM PG IBMS. She is not only excelled in her studies but also received a junior and senior research fellowship from Indian Council Medical Research, highlighting her dedication and commitment to her field of study. Dr. Padmavati, a highly accomplished researcher and serves as a dedicated research supervisor. She has an impressive track record, having guided 3 scholars to successfully attain their PhD degree. Currently, she is actually monitoring 5 scholars in their pursuit of PhD research. In addition, she plays a crucial part in upholding ethical standard in research. She serves as a member secretary of Institutional Review Board and the Institutional Ethical Committee at Sri Balaji Dental College. She has achieved several awards and honors throughout her academic and research career. She won the prize for her research paper titled Occurrence of Fluoroquinone Resistant Among ESBL and AMP-C Producing Uropathogen Escherichia coli at the International Seminar New Insight in Management of Antibiotic Resistance held at CLRI Chennai. She has received a Melinda and Bill Gates Foundation Young Investigator Award in Southeast Asia and India at the International Conference on Infectious Disease organized by the International Society for the Infectious Disease in 2016. She received an Innovative Research and Directed Academic Award in 2018 from Innovative Scientific Research Professional, Malaysia, and the Society of Innovative Educationalist and Scientific Research Professional, India. She was awarded the Innovative and Directed Research Award by Innovative Scientific Research Committee. Dr. Padmavati received the Research Excellence Award during 2021 from the Institute of Scholar, a registered institute under the Ministry of MSME, Government of India, and certified by International Accurate Certification. She has a thirst in microbiology, particularly in context of antibiotic resistant and infectious diseases. Her work may included in the study of antibiotic resistant pathogens like uropathogenic Escherichia coli and related topics within medical microbiology. She has served as a reviewer for several journals like Microbial Drug Resistant, Canadian Journal of Infectious Disease and Medical Microbiology, BMC on Oral Health, BMC Microbiology, American Journal of Immunology, International Journal of Antimicrobial Agent, then Journal of Applied Bioinformatics and Computational Biology. She has filed so far 4 patents and published 81 research articles in peer-reviewed journals. She has also published 21 books and book chapters. We are excited to explore the unique area of her expertise today, and we look forward to learn more from her. We are grateful to you, ma'am, being here and for enhancing our knowledge. Thank you, ma'am.
Thank you so much, ma'am. Now it's time to felicitate our guest as a token of respect and appreciation. Now we request our distinguished guest speaker, Dr. K. Badnavati ma'am, to address the gathering and to give your precious input to all the participants out there.
Check. Good noon, one and all. I'm starting like right at 12 noon today. You're all hungry, but I'll not take much of your time. Okay? So, at the outset, I wish to thank the organizers, the management of SRM Arts and Science College, the convener of the conference, Dr. Shireen, and the HOD of Microbiology, Dr. O.V. Ravikumar, and the Faculty of Microbiology for having invited me to deliver this lecture on biosafety. So, to introduce myself, I am a professor in microbiology at Sri Balaji Dental College and Hospital. I come from the dental fraternity. Hope I do justice to my talk today. So, biosafety and biosecurity, two terms which are often used synonymously, but they are not synonymous. So, biosafety. So, what was the pandemic we recently faced? COVID, isn't it? So, COVID pandemic highlighted the need for biosafety and biosecurity that the world requires. So, you're here, three departments put together: biochemistry, microbiology, and biotechnology. So, microbiology deals with microorganisms. Biotechnology, you deal with many of the genetically modified organisms and technological advances in the diagnosis and treatment of microbial diseases. And I thought it is apt to talk about biosafety and biosecurity in this gathering. So, biotechnology, is it a boon? Yes, but I will say it is a double-edged sword. Okay, though there are advantages, there are technological advantages in biotechnology, that is, it enhances the scientific knowledge and research. But at the same time, biotechnologists have a powerful weapon with you, your technical expertise, by which you can cause threats to the entire country. Okay, so I mean to say it is both beneficial as well as you can change it to be detrimental. So it's a double-edged sword. It has the potential to produce agents of mass destruction. So all of you here, I think you have it's a combined gathering of UG and PG together. PG, you'll do research projects, isn't it? So whatever you do research projects, what will you think? I want to complete the project. I need to get my dissertation completed. I want my degree. That is your idea behind. You want to do some project, do a project, get your degree. But whenever you're planning your research, you need to think of a good research. What does a good research involve? It involves good science as well as good ethics. You do a research, and this research you have to plan very much. At the same time, this research should give you something. The outcome of your research should have a societal relevance. There should be something good to the society. Don't be detrimental. Okay? What the researchers did for COVID-19, how we got the pandemic, it was negligence of biosafety or negligence of biosecurity, by which it is not only in Wuhan, but the entire world, we also suffer, isn't it? So coming to, whenever you plan a research, there is two things you need to follow. One is planning. Main thing is planning. It is a very, very, very critical time. Spend enough time. Spend the right people. Don't think you and your guide are the best people to plan your research. No, never. It is not at all. So always, whenever you plan a research topic, think of or question yourself. You should question yourself. First question is, am I following ethics? And number two, is there the outcome of your research, is this a risk is more or benefit is more? So plan it, and always plan for a research which is more beneficial when compared to your risk. The risk-benefit ratio should that is your maximum benefit and minimal or no risk. But whenever they say no risk in microbiology or biotechnology, it means they are False. There is minimal risk involved. Never say there is no risk involved in my study. There is risk. At least risk to yourself. Okay. So, moving to this. This is a very new article which is published in 2023 in Frontiers in Bioengineering and Biotechnology, which highlights the challenges that are faced in biosecurity and biosafety during the pandemic. So, you all are in biotechnology, many of you. So, are you following the guidelines of biosafety that is given by the Department of Biotechnology? There is not a single guideline. The guideline varies depending upon what you are dealing with. It is a genetically modified crop, is it a genetically modified organism or a biological? What you are using for your research or in your day-to-day experiments, that you need a guidelines. And when you deal with DNA or microbial organisms or microorganisms, these microorganisms are divided into 4 categories or risk groups, we call it, as risk group 1, that is usually a microorganism that can cause. It's not very harmful, okay, it can cause a disease in a plant or an animal or a human being. Risk group 2 involves, yes, it will cause disease, but when you are handling in the laboratory, you are also at risk. So, that comes under risk group 2. To the individuals, laboratory exposure or the lab technician or the biotechnician who is using it is also at risk. And group 3, it can be spread. You do your work in the lab, isn't it? Then you go home. Once you go home, you are going to transmit that infection or the microbe to your household. So, you are again, that is under risk group 3. And risk group 4 will be dealing with highly fatal organisms. Organisms which can cause potentially infectious diseases. Coming to this, for biosafety, many of your microbiology, many of the labs, especially microbiology and biotechnology, will have a cabinet for working. What do you call the cabinet as? Biosafety cabinet. So, this biosafety cabinet, or there are different levels of biosafety that is required depending upon what you are using. Okay. So, moving on to that, biosafety level 1 to 4, the least will be biosafety level 1, the highest risk pathogens you have to deal only with biosafety level 4 cabinets. So what is this? Biosafety level 1, you can see here, this is a person who is handling a culture, a microbial culture. It is only in the lab desk or is on the workbench. There is no laminar airflow required for this. So, this is safety level 1 where the researcher or the technician is handling the organism on the workbench, that is A, and he is using the PPE. What is PPE? Personal protective equipments. He is wearing the gloves, goggles as well as the lab coat. Okay, this was a picture taken before COVID. So, no mask is there. Okay. So, this is the level 1, biosafety level 1, wherein you deal with only non-pathogenic organisms. Non-pathogenic microbes, for example, most often your commensals. Name a commensal in your body. E. coli is a commensal in your intestine. When you are dealing with E. coli, it is not required for you to deal it with a laminar airflow. You can just do it on a workbench. On the other hand, when you go to the important organisms, the pathogenic microbes, for example, Salmonella typhi or Shigella, in that case, you cannot use a workbench. Instead, you have to go for biosafety level 2, wherein personal protective equipments the individual is wearing, plus they are handling only inside a cabinet. So, that is biosafety level 3. I am telling these levels in the simplified manner. Okay. Safety level 3 is Mycobacterium tuberculosis. What does it cause? TB, isn't it? How is TB spread or transmitted? Through droplet nuclei, through air, isn't it? So, whenever there is a respiratory pathogen that is being handled, especially if it is Mycobacterium tuberculosis, they have to have biosafety level 3. And what is the difference between 2 and 3? the only thing is this person is also wearing everything, but they are closed their nose, isn't it? So they are having a face shield is there because it is a respiratory pathogen, and same laminar airflow is there. Additional to that, can you see a tubing here? Yes, they have a HEPA filters in the laminar airflow, and it should be a positive pressure. The lab itself should have a positive pressure. On the other hand, when you go to the handling extremely pathogenic organisms, for example, Ebola or Marburg, in those cases you should have what is called as biosafety level 4, wherein here it is totally contained environment, and these biosafety level 1 can be in your college lab. Biosafety level 2 can be in your college lab. Biosafety level 3, it should be little away from your college where your students are working. Only expert people can enter this BSL2, and BSL2, can you see the C here? It is automatic closing and opening door. You cannot touch the door, go in and come out. And there should be an ante-room for the biosafety level 3. This biosafety level 3 is in TRC or NIRT, now called as Tuberculosis Research Center. And biosafety level 4 cannot be in a society or cannot be in a region where people are dwelling, in a residential area or in a commercial area. This is usually in an isolated area because there are very many chances for outbreaks. Coming to, so you handle all this. How do you discard your waste? See, I am not talking anything new. I am just talking whatever has to be done. Okay? So how do you discard your biochemical waste, or biomedical waste? In a container. What container? You can be wrong, you can be right, no issues. I was also sitting like this maybe 25 years back. You discard in containers. Yes? You just throw it in the dustbin. It is biohazard. Not all are biohazardous. So coming to, there you have a rule given by the government of India called as the biomedical waste management rule that was initially put forward in 2016, and finally changes were done in 2018 and 19, what you call it as, it is an amendment that was done in 18 and 19. So you have different color coded bags like this, okay? So you have different color codes. You cannot throw everything in one bag, okay? All your needles, biochemistry, do you deal with blood? Yes or no? Yes. How do you collect blood from a patient? Using a syringe and a needle. What type of syringe and needle? A disposable syringe and needle. At least after the HIV, you use only disposable syringes and needles. So you cannot discard a syringe and needle as such. You are supposed to separate the needle. You have what is called as a hub cutter or a needle destroyer, after which this sharp should be disposed, sharps should be disposed only in this leak-proof containers. It cannot be put in anything else. That is white colored. On the other hand, you have red color. So any infectious waste. Okay, on blood transfusion, what we do? Blood transfusion kenna pannu? All of you are in science field, isn't it? So blood transfusion or blood bag irukuma. Can I be bilingual, ma'am? Yes. So you have a blood bag, isn't it? Which you have an IV set through which they insert into the antecubital vein, and they insert it to the recipient. So you have a blood bag. After the blood is transfused into the recipient, where should it go? It should go to the red bag. It cannot go into any other color because blood is an infectious material. Though they screen for HIV, HBV, HCV, etc., still they can be potentially infectious, and this blood bag is made up of plastic. So it should go only in the red color container. It cannot go in any other color. So plastic infectious waste should go only in a red color container. All your vacuum gloves you are using, isn't it? Gloves, again it should go only to the red color container. Or plastic aprons you are wearing, that should go. Your goggles, the plastic goggles you wear, transparent goggles, should go only to a red color container. The next is yellow. What is yellow? All infectious waste should go only to the yellow color container. All your pathogenic agar plates, whatever you're doing, put it in yellow bags. If it is agar plates with all your cultures, put in yellow bag, autoclave it and then give it to somebody. Okay? So it is only infectious non-plastic waste should go only in the yellow color bag. It cannot go in any other bag. Okay, being it, I'm from a dental college. So if they are extracting the tooth, what is the tooth? In which waste which will come under? Tooth na enna teeth kadayadu. Correct da? Singular plural. Illan sollala. But still, it is a human anatomical waste. It is a part of the body, isn't it? So it is a human anatomical waste which should go only to the infectious yellow color containers. So suppose somebody has a wound. Okay, there is an RTA. What is RTA? Road traffic accident. Okay, you have a massive bruise. So you put a bandage, isn't it? Bandage in the sense you have a wound dressing. Then you put a micropore, everything. Where do you discard it? It should be in yellow color waste. So infectious waste should go on, non-plastic infectious waste should go only in a yellow color bag. All microbiological waste should go only in a yellow color bag. This is blue color. It is tear proof, or what you say, it is what is hard plastic wherein you put all the glass bottles. You for biotechnology also, you will buy some chemicals in glass bottles or injections in glass bottles, or if it's cell culture you use MEM, minimal essential medium and fetal calf serum, everything. Whatever is glass, if it is a glass vial, if it is an ampule which you have broken, all the glass vials should go only in the blue color waste. So injection ampules, everything only in the blue color bag. So final disposal. So ella baglayum potachu. In the bag enna pannuvom namba? So all these bags you cannot discard, you cannot keep in the street. You should have a place in your institution itself, and you should have a an agreement with the company. What I have put in my college, I am just focusing here. It depends on which district. You are in Kanchipuram district, Chengalpet district. So I am in Kanchipuram district in Greater Chennai area. So I have a different company. So you have what is called as outsourcing. Neenga panna kodadu ediyume. The bag la katti vekkiradoda enough. You have to have an agreement with the third party which is approved by the government. Even if it is a small clinic, or clinic போட்டு உட்காராங்களா, ஒரு 10 ரூம்ல clinic போட்டு உட்காராங்களா, அவங்களுக்கு கூட they should have an agreement. So that third party is called as Common Biomedical Waste Treatment Facility. The third party is called as a Common Biomedical Waste Treatment Facility. அவங்க வந்து உங்க பேக் எடுத்துட்டு போவாங்க. எப்படி கார்ப்பரேஷன்ல வந்து மக்கும் குப்பை மக்காத குப்பைன்னு 2 பேக் எடுத்துட்டு போறாங்கல்ல, அதே மாதிரி இந்த கலர் கோடட் பேக்ஸ் you cannot send it to your corporation. You have to have a agreement with a Common Biomedical Waste Treatment Facility wherein they have the rights to discard. And this is the company with which I have got tie-up. We have got tie-up, that is GJ Multiclave. They will come and collect all this. எப்படி open வண்டியிலலாம் எடுத்துட்டு போக முடியாது. It is a closed vehicle with GPS. So it will be tracked. And all our color coded bags, barcode இருக்குல்ல, ஏதாவது ஒரு சூப்பர் மார்க்கெட்ல போய் நீ வாங்குனீனா, similarly we have a barcode. I should say how many bags I am sending per day. Yellow bag எத்தனை கொடுத்தேன், white bag எத்தனை கொடுத்தேன். So everything is accounted. You are accountable for any breach in biosafety or biosecurity. So then they have a common facility here in Adayar where they will do all the disposal. அவங்க yellow bagல இருக்கிறது என்ன பண்ணணும், whiteல என்ன பண்ணணும், red என்ன பண்ணணும், they know what to do. And they are under the control of the Pollution Control Board. So coming to, so this is one part of it. I am just touching all aspects of biosafety. For maybe it is beneficial or not, I don't know. And we are at risk. I am telling microbiologists, biochemists, as well as laboratory technicians and biotechnical scientists, we are at risk. We are at occupational risk of acquiring mainly blood-borne pathogens. What we mean is hepatitis B virus, hepatitis C virus and HIV virus. These are the 3 common blood-borne pathogens we are potentially exposed to. So of these 3, hepatitis B, hepatitis C, and HIV, you can see the risk is very high in the case of hepatitis B virus, 30%. Hepatitis C, it is only 3%, but HIV risk is only 0.3%. But all of us are worried only about HIV. Okay, because there is a social stigma. HIV patient na நம்ம கைக்குள்ள கூட மாட்டோம் இல்லையா? There is a social stigma. But the risk of HIV is less. But risk of HBV is 100 times more compared to HIV. So this occupational risk can be of 3 types. Nee lab la you are working, isn't it? You can have different types of injuries in the lab, which we classify the injury as if it enters your oral cavity. Nee work pandra, streak pandra, isn't it? When you are streaking, for example, in a microbiology, when you are streaking, some people have the what to say mannerism on paathu ipo yaraga ootrona nee vaaya tharandire saapra ootuva. Similarly, when you streak it, you also open your mouth, isn't it? So that is the possible entry for the pathogenic microbes. Okay, sometimes there can be a splash. When you deal with liquid cultures for biotech or for micro whatever, when you deal with liquid cultures, you can drop it on your skin. Okay, your skin can have a cut, you don't know. Okay, so அருவி படம் பாத்தீங்களா எல்லாரும்? என்ன பாத்தீங்கல்ல? எப்படி HIV வந்துச்சுன்னு சொல்லுவாங்க அந்த படத்துல? blood transfusion வந்துச்சா? இல்ல நான் படத்தை தப்பா சொல்றேனா? இளநீ வெட்டி வந்துச்சு இல்லையா? இளநீ வெற்றவருக்கு HIV இருந்திருக்கும். அந்த இளநீ வெட்டி அவர் அந்த ஸ்ட்ரா போடும்போது பிளட்டோட ஸ்ட்ராவை இளநீக்குள்ள போட்டுருவார். அப்படிதானே கான்செப்ட்? ஓகே, அது உண்மையோ பொய்யோ, தட் இஸ் டிஃப்ரெண்ட். ஓகே, சரி, இப்போ ரீசெண்டாக HIV டிரான்ஸ்மிஷன் எப்படி வந்துச்சு? ரீசெண்ட் படத்தை விட்டுரு, ஆக்சுவல்ஸ் கேட்குறேன். tattoos. Okay, so sharing of needles can be a cause. Okay, so tattooing, so உனக்கு எப்படி உனக்கு இன்ஃபெக்ஷன் வருதுன்னே உனக்கு தெரியாது, பட் யூ நீட் டு பி காஷியஸ். ஸோ இளநீ வெட்டுற இன்ஃபெக்ஷனை நீ போய் கண்ட்ரோல் பண்ண முடியாது, பிகாஸ் இட்ஸ் அவுட் சைட் யோர் பெர்வியூ. டாட்டூயிங்கு உனக்கு டாட்டூ வேணாம் நீ தான் சொல்லணும். யூ ஷுட் ஹாவ் செல்ஃப் கண்ட்ரோல். இல்லை நீ டாட்டூ போட்டால் வந்துச்சுன்னா இட்ஸ் இன்னெவிட்டபிள். பட் whenever you are in the lab, it is your duty to protect yourself as well as to protect your family when you reach home. That is what we are worried about. So கட்டி இருக்கு ஸ்கின்ல, bacteria உள்ள போச்சுன்னா infection is more compared to what that is called as a non-intact skin. There is a cut or a bruise. What immediately you should do? You put a bandage. Okay, you put a plaster, so that you are giving a potential barrier or a physical barrier for the entry of the pathogens. Next is intact skin. Skin correcta irukku, endha katte illa idu mela patta not much of difficulty. So this is called as splash injury. தெரியாம கீழே வந்து தெரிச்சா வர injury, you call it as splash injury. And needle blood எடுப்பியா biochemistry? Yes, you'll so என்ன பண்ணுவ, needle எடுத்துட்டு திருப்பி கேப்பை போடக்கூடாது. ஸோ ரீகேப்பிங் ஆஃப் நீடில்ஸ் ஷுட் பி 100% avoided. You should not recap the needles. If at all you want to recap the needle, left handல நீடிலோட கேப்பை வச்சு ரைட் ஹேண்டில் இப்படி போடாது. ஏன்னா அப்போ யாராவது வந்து இப்போ என்னையே பத்மா அப்படின்னு கூப்பிட்டாங்கன்னா what I'll do? I'll turn and I will have my prick. That is a needle stick injury. So avoid all that. So always, once you practice, it will come by itself. It will be a reflex for you. So whenever you don't do recapping, if at all you require a recapping, put the needle cap on the table or whatever, and then use only one hand. Don't use the other hand. குத்துனால எங்க போய் குத்தும்? அந்த டேபிள் மேல தான் குத்தும். Okay, so that is called as single hand scoop technique. That is what you need to follow when you are recapping. Never recap needles, but if at all you recap, use a single hand scooping technique for recapping. சரி, வந்துடுச்சு, விழுந்துடுச்சு, குத்திடுச்சு. So what we need to do? You to do a first aid, isn't it? என்ன first aid பண்ணுவோம்? So needle stick injury ஆயிடுச்சு, என்ன first aid you will do? என்ன பண்ணலாம்? Wash the skin. Then wash the skin na போய் குளிச்சிருவியா? Wherever the site of inoculation you will, okay, then with what? See, you can be wrong. இது வந்து நீ படிக்கிற, நீ ஃபர்ஸ்ட் மார்க் வாங்குற, நீ 90% அதெல்லாம் கிடையவே கிடையாது. நீ வந்து லாஸ்ட் மார்க் வாங்கினா கூட your life is more precious than your profession. Okay? Your life is more important than your accreditation or award. So be careful with your life. So என்ன பண்ணணும்? வாஷ். என்னத்துல வாஷ் பண்ணலாம்? You can use detergent soaps. அப்புறம் வேற? You can use sanitizers. சொல்றது எல்லாரும் கரெக்ட் கிடையாது. I'm just asking options from you. Dettol போடலாம். Okay? But good. It is, though one or two are listening, we are happy. See, you should know. Okay? It is not that I am coming and preaching something. No. You will all be handling it in a day-to-day life. So one, always wash the wound. Woundன்றது என்ன? உன் நீடில் குத்துனதுனால வந்த wound. Whatever be the wound, wash the wound with normal soap and water. Okay? Never use sterilium or your hand rub. No. Previously நீ பழைய எடிஷன் புக்கெல்லாம் பார்த்தீங்கன்னா அங்கே போட்டு ஸ்டெர்லியம் போட்டு வாஷ் பண்ணு, இல்லை ஐசோப்ரோபைல் ஆல்கஹால் போட்டு வாஷ் பண்ணு, it will be given. No, it is not ideal. Why? Because if you put your sterilium or isopropyl alcohol or any alcohol based hand rubs, what will happen is that wound வந்து இன்னும் நீ வெந்த புண்ணிலேயே வேல் நுழைக்கிறேன்னு சொல்லுவாங்க இல்லையா, ஸோ ஆன புண்ணிலேயே நீ இன்னும் இன்க்ரீஸ் பண்ணுற இரிட்டேஷன். ஸோ இட் will easily go inside. Which one? Your hepatitis B virus or HIV virus will go inside very easily. Instead, use only soap and water to rinse it and தேய்க்காது. இன்னும் முன்னெல்லாம் என்ன பண்ணுவோம், அழுத்தி அழுத்தி உள்ள போன வைரஸை வெளியே எடுக்கிறோம் ட்ரை பண்ணுவோம். Isn't it? That is what we generally do. That is our, we have been trained. But don't do that. Never squeeze out. Okay? By squeezing, you are doing a tissue destruction by which you are facilitating the entry of the virus. So just wipe it with soap and water and rinse it or flush it. Never use antiseptics, chlorine, alcohol, anything. Suppose blood நீ பயோகெமிஸ்ட்ரியில் எடுக்கிற ஒரு வேக்யூடைனரில் they are giving you blood, இல்லை டெஸ்ட் டியூப்ல they are giving you blood. அந்த blood splashes into your eye. கீழே விழுந்து தெரிக்கும் போது நீ குனிந்துட்ட, ஐயோ விழுந்துருச்சே நீ குனிற. So it comes to your eye. What you should do? Again wash your eyes or flush your eye, irrigate your eyes with water. Soap போட மாட்டா கண்டுக்கு இல்லையா? So water, flush it profusely. And if you are wearing a contact lens, remove பண்ணாத contact lens. Leave the contact lens as such. Wash it profusely with water. எல்லாம் வெளியே வந்துருச்சு அப்படின்னும் போது then only you remove your contact lens. If you are glass wearer or a contact lens wearer, the glass or the contact lens itself is acting as a barrier for you. It will not allow the virus to enter. Mouth, again what you should do? With saline or water, you rinse it, gargle it again and again. So most importantly, tension agadu. Okay? Do not panic. Even if you have a needle stick injury, do not panic. So what are the do's and don'ts? You gloves potandina, remove your gloves, wash it with running water or saline for eyes and mouth. And most important, கையில குத்திடுச்சுன்னு முன்னெல்லாம் என்ன பண்ணுவோம், டக்குன்னு வாயில வச்சிருவாங்க கையில இல்லையா? நீ ஸ்கின் வழியா உள்ள போவாத, ஓரல் கேவிட்டி உள்ளேயாவும் HIV வைரஸ் உள்ள போக விடக்கூடாது. Okay, HBV. So do not panic, do not pick your finger in the mouth, do not squeeze it so that உள்ள போனது எல்லாம் வெளியே வந்துடணும். Don't try it. And do not use any alcohol or bleach or chlorine. Never use sterilium whenever you are having a injury. So அது பண்ணி முடிச்சுட்டு what you should do? You should check yourself whether you are infected, because it has gone. நம்ம naked eye இருக்கத மட்டும் தான் we can remove it, but you should check for yourself. You check for HIV antibody, you check for hepatitis B virus surface antigen, antibody against hepatitis C virus, and antibody against hepatitis B virus surface antigen. More importantly, you have what is called as post exposure prophylaxis. See, expose ஆயிட்ட, we don't know whether the patient is HIV positive. Blood கொடுக்குறாங்கல்ல உங்களுக்கு டெஸ்ட்டுக்கு, மேம் வந்து மேம் or sir, whoever is giving you, இது HIV negative blood ன்னு சொல்லி கொடுக்குறாங்களா for your experiment? So you should think everything to be potentially infectious. இவங்களுக்கு HIV இருக்கலான்ற கண்ணோட்டத்திலேயே நீ வேலை பாரு, you will be safe. Okay, so think everything as potentially infectious. So soon after an injury, be a needle stick injury, be a splash needle stick injury, we call it as percutaneous injury, or a splash injury or a mucosal injury, you should have what is called as a post exposure prophylaxis. Preventiva நீ சில tablets எடுக்கணும். That is called as post exposure prophylaxis for HIV. So when should you take it? இன்னைக்கு எனக்கு needle stick injury நடக்குது. Okay, I have pricked my hand. Within 72 hours, now I should start this, initiate the post exposure prophylaxis. But beyond 72 hours, there is no use. Okay, there is no use in taking your post exposure prophylaxis, but it is ideal to take within 2 hours. Now you have the needle stick injury, within 2 hours you start your post exposure prophylaxis. It will reduce, before 72 hours it will reduce 80% chance unakku varad. Even if the patient had been HIV positive, in the treatment edithina you will not get HIV. And I'm not going to the, and what is the treatment you need to take? It is TLD. The treatment is shortly, see this treatment regime will also vary from day to day. We should have the guidelines from the NACO, from the National AIDS Control Organization, which gives the guidelines. The tablets were different 2 years back and now it is different. The current regime is, it's called as a fixed regime. நீ lifelong எடுக்க வேண்டாம், only you should take for 28 days. That is a period of 4 weeks, a short term treatment. And that is tenofovir, lamivudine and dolutegravir. Only these three you shortly called as TLD regime. If it has been HBV, again we don't know whether it is HBV. Which is more infectious? HBV, HCV, HIV? HBV. How many times HBV is more infectious than HIV? 100 times. So take home message, onnu therinjicha, enough for me. Okay, 100 times it is more infectious than HIV. And here you cannot wait for 3 days, 72 hours kadayadu. You should take the treatment before 48 hours. Your time is running out. It is highly transmissible and it is more replicative. Okay, so you have to be very careful with hepatitis B virus. Hepatitis B virus infection paatha theriyadu. He or she, the patient, you cannot identify based on clinical examination whether the patient is HBV positive. But HIV positive patient vaaya tharandale therinju. Okay, they'll have candidiasis. Most common opportunistic infection will be candidiasis. There will be white patches in the tongue. Again they'll have wasting syndrome. ஒல்லியா இருப்பாங்க இல்லையா, ஒரு மாதிரி இருப்பாங்க. So பார்த்தாவே you can identify the patient is HIV positive. But hepatitis B you won't know and it is more infectious. So start the treatment within 48 hours. Okay, maximum within 48 hours, but ideally within 6 hours. What should be the treatment? You should take what is called as HBIG, hepatitis B immunoglobulin. You have immunology in your syllabus, right? Yes, both BSc and MSc. So it is coming under artificial passive immunity. You have give ready-made antibodies for immediate protection. It is an emergency situation. Body poi B cell plasma cell convert ஆகி plasma cell produce பண்ணது antibody na அவ்வளோ நாள் வெயிட் பண்ண மாற நீ போயிருவே. Okay, still what you give is ready-made antibody, give a flush. Okay, so that is given. And other than that, all of you have been vaccinated for hepatitis B? Yes, how many of you are vaccinated? Just put your hands up. Really vaccinated. Less than 10% of the crowd is vaccinated. See, among the 3 bloodborne viruses which can be transmitted through your occupational risk, only vaccine preventable disease will be HBV. HCV ki vaccine illa. HIV ki vaccine irka? HIV ki vaccine irka? Irunda ellarum pottu suthittiruppan. Illa. No, it is not there. Okay, so HBV alone is a vaccine preventable disease. And it is mandatory that all of us should receive the HBV vaccine, all the 3 doses. It comes in 0, 1 and 6. இன்னைக்கு எடுக்கிறது 0 dose, 1 month எடுத்து second dose, 5 months அப்புறம். That means totally 6 months அப்புறம் you have the 3rd shot of the vaccine. And this is, you should be vaccinated. Once you get the 3 doses of vaccine, you are protected for your lifetime. If your antibody titer is more than 10 milli international units per ml. Okay, I'm not going. So இதெல்லாம் பண்ணிட்டேன். Okay, you have done the first aid, you have taken the post exposure prophylaxis treatment, everything, and then what you should do, again you retest yourself 6 months அப்புறம் for HIV, 6 weeks later HIV, again 3 months, again 6 months. So 3 times you should do a check. For HPV and HCV, 6 months later again you do a test for yourself whether you are infected or not. So what is better? Prevention is always better than cure. See, I am not talking everything which is be important to your curriculum or whatever. It will fetch marks for you. It is for your life. Okay, prevention is better than cure. And what is PPE and what is PEP? I am not completed. What is PPE? Am I running out of time? What is PPE and what is words the dimari irukku? So PPE is personal protective equipments. PEP is post exposure prophylaxis. So use PPE to avoid PEP. Okay? So how will you, what are the personal protective equipments you know? Okay, gloves, mask, dress and sollakudadhu, we should call it as an apron. Okay? Okay. Okay. Mask, gloves, apron, aprom goggles. Goggles illana face shield. So goggles will protect only your eyes. Your face shield will protect your eyes as well as your mouth. Okay. So these are the basic 4 PPEs that you used to have. So idu eppadi podanum? Eppadi podna ma'am, mask engalukku poda theriyada? Don't ask like that. Okay. Gloves. Don't we know to wear a gloves? You know it. But there is a procedure or a stepwise manner in which you should wear it and you should remove it. That is called as doffing and donning of PPE. So this is the sequence. First enna pannum? This is the sequence in which you need to wear. First you should put the apron. Okay? So first the apron is otherwise called as a gown. First you should wear the gown, and gown podumbodhu eppovume the knot should be at the back and your front should be fully covered. So it should be at the back. So gown should be worn first. Then you should use the mask or the respirator. Then you use the goggles or the face shield. And last will be your gloves. Gloves are first potne. Adukapra nee elladhiyum thottu potittu irukka koodadhu. Is it clear? So this is the sequence of doffing and donning. So the other way around. இது எப்படி இருக்கு? எது லாஸ்ட்? gloves. நீ இதெல்லாம் போட்டுட்டு நீ ஒரு டெஸ்ட் பண்ற உன் லேப்ல. For example, I am more importantly, you are going to pass out and you become biochemist in a lab or a microbiologist in a hospital. You should know this. So எது will be highly contaminated? Gloves. அதை வச்சு தானே நீ எல்லா டெஸ்டையும் பண்ண போற. ஸோ அதை தான் ஃபர்ஸ்ட் ரிமூவ் பண்ணணும். ஸோ லாஸ்ட்ல போடணும், ஃபர்ஸ்ட்ல you should remove it. So gloves should be removed first. And gloves remove பண்ணும்போது எப்படி ரிமூவ் பண்ணணும்? I don't have a glove here. Actually remove the gloves from here. Okay, don't touch like this and remove. That is the wrongest way. Okay, put like this and remove it. Then next you should remove your goggles or your face shield, then your gown, and then your mask or the respirator, followed by wash your hands. So this is the sequential procedure for doffing and donning. Wash your hands. Thanni illa enna pannalam? Hand rub. You use your sterilium or whatever alcohol based hand sanitizer. Again you have a procedure how you should start and how you should end for both your hand rub as well as hand washing with water. So take, first will be rub your palms. I'm sorry. So first will be rub your hands palm to palm. Ipdi pannu. Okay, so there is actually a dance for this. For how do you do it? Then you put your right palm, I'm sorry. Then put your right palm over your left dorsum and do it. Then in between the fingers, back of the fingers, and then rotational with your thumb, followed by the rotational rubbing on backwards of your right hand with your left palm, and followed, then you allow it to dry. ஸோ டோட்டலி இதை பண்ணுறதுக்கு எவ்வளோ நேரம் ஆகும்? நம்ம 5 செகண்ட்ஸில் முடிச்சிடுவோம் இல்லையா? That is what we do. But how much duration is ideal? 20 to 30 seconds. Only then all the microbes that is in your hand will be decontaminated or will be destroyed by your alcohol based hand rub. And this is the method for your hand washing. Again, I am not going into the details of it. And you have October, you have organized a conference. Today is 12th. 15th is a hand washing day. Okay? You have, so that's why I chose this topic of biosafety in the month of October. So it is a global hand washing day so that you can prevent at least 1 in 3 diarrheal diseases and 1 in 5 respiratory infections can be reduced by hand washing. Clean your hands at least with water. Soap illanalum at least with water, that will reduce your contamination. And October is also celebrated or commemorated, I should say, as the biosafety and the biosecurity month. Biosafety ko biosecurity ko ஒரு word dama difference. Only one single word is difference. Unintentional release. தெரியாம கொட்டுச்சுனா biosafety will be there. தெரிஞ்சே தப்பு பண்ணா biosecurity issue. Okay? So knowingly and unknowingly, that is the only difference between biosafety and biosecurity. So இதெல்லாம் என்ன? I'll rush up. What are these? Microbiology. Bamboo stick appearance. எதுக்கு இருக்கும்? Bacillus anthracis. Okay, this is Yersinia pestis. This is Vibrio cholerae. This is smallpox virus. This is Marburg virus. இதெல்லாம் என்ன? Naturally they are pathogens. But these pathogens can be modified as a bioweapon. Okay, it can be modified as a naturally pathogen, but you can use it as a bioweapon and causing mass destruction. So it is not new. It has been for centuries. Even in the past millennium, they have used it. Saliva of rabid dogs, they have mixed, given to the enemies. Who? The Polish people. And in all these First World War, Second World War, everywhere, they have used these organisms as bioweapons against the soldiers of the opponent country. So cholera, scrub typhus, everything. So anything can be potentially, and more importantly, when you are using your biotechnology or genetic engineering, handling these emerging pathogens, and now coronavirus will also come under this emerging pathogen, that is Hunter, Nipah and multi-drug resistant bacteria, you need to be more cautious. So with this, I stop my presentation. Thank you. Thanks for your patient listening.
Thank you so much, ma'am. Your insights and perspective are truly valuable, and we were all thoroughly engaged by your presentation. And we have 10 minutes for question and answer session. Please raise your hand if you have any questions for discussion.
Microbial load. In that scenario, you told we should discard contagious waste, microbial waste, non-plastic waste, and yellow color bag. In case of this agar plate, after autoclaving, in which bag we should discard?
It is based on which plate you are using. Is it a glass plate or a disposable plastic plate?
Disposable plastic plate.
What you need to do is, you scoop the agar. Just you put a, what to say, your wire, no? It will come out. You put it in a yellow bag. The agar you can put in a yellow bag. The plastic will go in a red bag.
The thing is, we are using like 200 plates or autoclaving at a time. We can't take out the agar after autoclaving because it will.
See, 200 plates in the sense, is it a clinical lab?
Preclinical lab, genotoxicity.
Genotoxicity. See, it is not that whoever, you should have an attender who can, but you should train your attender also. Oh.
Always have this confusion whether it is having a plastic, so it should be regarded in
See, actually, even this holds good for needles with syringes with fixed needles. Okay, some syringes, your needle you can remove, syringe, the barrel and the piston will be separate. That is one case. Another type of syringe will be with fixed needles. For example, your insulin needle, it's a fixed needle. You cannot remove the needle and you cannot remove the barrel.
some containers will have
So,
cut the needles alone.
yeah, that is a needle cutter or a hub cutter where you destroy that and put it in the plastic should go in the red. So you cannot do everything by yourself and it is always a team. Okay, 200 plates you will not discard at one point of time. End of the day it is 200, am I right?
While doing aims,
It's okay. Okay, but what you can do is just you have a spatula, backside of the spatula is flat, isn't it? Or you have a nichrome wire, you just put the nichrome wire, it will take hardly maximum 5 seconds for one plate to remove. If you can't do that, better put it in yellow bag. If you are not able to segregate the plastic and the agar, plastic petri plate and the agar, put directly in the yellow bag, that is okay. But not in the red bag because disposal of these color coded bags are different.
hi ma'am, I'm Sweetie. In COVID period, doctors order personal protective equipments and all, ma'am. Then why they cause that infections, ma'am?
You have
Actually, we have
infection for the doctor.
yes, ma'am.
Okay, actually, in order to prevent infection to their households only, they were given quarantine. 15 days work, 15 days quarantine, or 6 days work, 6 days quarantine. So why did they get? That's what you are asking. See, this doffing and donning, if they have done properly, they would not have got. Okay, and mask, you are putting a, what to say, tying mask, isn't it? Tying mask la ethana ties irukum? 2 கயிறு இருக்குமாமா tying maskல 2 ties are there. So always you remove the lower one. Next only you should remove the top one. But எல்லாரும் என்ன பண்ணுவாங்க? Hanging mask ஓட தான் சுத்துவாங்க. What is hanging mask? Top knot they will remove and the mask will be hanging here. Okay, that is the major reason, and accidentally, because their level of exposure is very high. So it is an emergency situation. But in the emergency situation, how could have avoided? Johan could have avoided by biosafety and biosecurity. Adu avoid பண்ணாததுனால தான் problem for the doctors. So,
I have another question, ma'am. Is there any research proof for HIV, PEP? PEP follow பண்றதுனால நமக்கு வந்து 80% cure ஆகும்னு சொல்லிட்டு ஏதாவது
yeah, there are documents. There are substantial scientific reports telling that they have always we do survey. Retrospective studies we do on post-exposure prophylaxis. So there should be some clinician or a physician. There is a reporting officer in every institution. நீ ஒரு ஹாஸ்பிட்டலில் போய் வேலை செய்கிறன்னா உனக்கு இந்த மாதிரி ஆச்சு, suppose you are a technician there or you are a biochemist there, you have a lab director to whom you should report, and the lab director should report it to the MD of that hospital or somebody, and they have to report to a government official. All these should be reported. So avungalukku if, and also suppose I have a needle stick injury, I am working in the lab and I don't give my consent, எனக்கு ட்ரீட்மெண்ட் வேண்டாம் நான் சொன்னா நீ கொடுக்க முடியாது. பட் எனக்கு HIV வந்தா you are not responsible. Do you understand what I say? So I have encountered a needle stick injury, I have reported to my higher officials, and post-exposure prophylaxis has to be initiated and all the tests need to be done. But if I don't consent, எனக்கு டெஸ்ட் வேண்டாம் நான் மருந்து எடுக்க மாட்டேன்னு சொன்னா நீ என்ன ஃபோர்ஸ் பண்ண முடியாது. பட் நீ என்ன பண்ணலாம்? திருப்பி லேபுக்கு வராதன்னு சொல்லலாம். மருந்து எடுன்னு என்ன ஃபோர்ஸ் பண்ண முடியாது. பட் நீ லேபுக்கு வராதமா, யூ ரெஸ்ட்ரெயின் யுவர் செல்ஃப் அன்டில் ஃபார் 6 months. உனக்கு இன்னும் நெகட்டிவ்னு சொன்னால் மட்டும்தான் யூ கேன் கம் டு த லேப். But there are documented reports. And the 3 days, 6 weeks, 3 months, 6 months சொன்னா இல்லையா, post exposure prophylaxis testing, அதெல்லாம் பண்ணிட்டு எந்த ஹவரில் எடுத்தாங்க. ஸோ எவ்ரிதிங் இஸ் டாக்குமெண்டட். ஸோ இட் இஸ் scientific documents what I am telling you.
Okay, ma'am. Thank you so much.
Thank you.
Hello ma'am, my question is, can HPV be transmitted from mother to a baby? In case, how will the infant be treated?
Okay, so it is called as parent to child transmission or a vertical transmission from an infected mother to an infected baby. So this is off. Okay, this in that case the baby should be given what is called as HBIG, hepatitis B immunoglobulin, within 12 hours after birth. And moreover, if the mother is HBV positive, we do a series of tests. In hepatitis B virus, we have got 3 important antigens called as hepatitis B surface antigen, hepatitis B core antigen and pre-core HBsAg, HBcAg and HBeAg. எல்லாருமே HBsAg மேல தான் ரொம்ப ஆர்வமா பார்த்துட்டு இருக்கோம். But if the pregnant mother is hepatitis B positive and the mother is also positive for hepatitis B E antigen, அப்ப nearly 90% the baby will have the infection. So அந்த babyயை terminate பண்ணக்கூடாது. The baby should be born. Medical termination is not allowed. The baby should be born, but soon after birth, within 12 hours, we should give what is called as HBIG. We should protect the baby. Virus multiply ஆக விடக்கூடாது.
At home level, we use this glucometer for blood test.
Yes.
And then insulin. Those needles and all, how will we discard it? Because usually they just throw it off in the normal waste, but no biosafety is maintained.
Yes, it's a very good question what you have asked. In our day-to-day life, for diabetes, there are insulin recipients. You take insulin. So insulin needles are there. Or you check your blood glucose level using glucometer. So how do we discard? Wheatla, you cannot follow this color-coded bags, isn't it? But one simple thing you can, what I follow, what I tell others, I think what I am telling now is not, I can't say it is 100% correct. I am giving an option only. நீ எப்படியும் ஒரு கோக்கு ஏதாவது ஒரு பாட்டில் வாங்கி குடிப்பியா? Yes, கோக்கு பெப்சி வாட் எவர் பெட் பாட்டில்ஸ் யூ ஹேவ், ஆர் அட்லீஸ்ட் இன் கேன் பெப்சி இதெல்லாம் குடிப்பல்ல. ஸோ அதில் ஒரு சின்ன ஓப்பனிங் தானே அந்த கேன் பெப்சி குடிக்கிற பாட்டிலில் இருக்கும். யூ ஜஸ்ட் ஃப்ளிப் இட் ஆஃப் அண்ட் ட்ரிங்க் இட். இட் இஸ் பங்க்சர் ப்ரூஃப். அதில் சட்டுன்னு ஓட்ட வராது. ஸோ என்ன பண்ணி இந்த நீடில் the glucometer and the strips இருக்கு இல்லையா, ஸோ ஆல் தட் புட் இட் இன் தட். உனக்கு ஏதாவது ஒரு ஃபிசிஷியன் இருப்பாங்கல்ல, யாராவது டாக்டர் சொல்லி தான் நீ இன்சுலின் எடுக்க போகிற, இல்லை டாக்டர் சொல்லி தான் நீ வந்து ஒரு குளுக்கோமீட்டரில் செக் பண்ண போகிற. இந்த பெப்சி பாட்டில் கேன் வித் ஆல் தீஸ் குளுக்கோமீட்டர் ஸ்ட்ரிப், go give it to him, he or she, the doctor. So he will have this agreement with him. அவங்க கிளினிக் இது இல்லாமல் ரன் பண்ண முடியாது. அந்த அக்ரிமெண்ட்டை இப்போல்லாம் நோட்டீஸ் போர்டுன்ற ஃப்ரேம் பண்ணி போடணும். Every year they have to renew the agreement, otherwise the pollution control board will stop their practice. They cannot practice anymore. So that is the easy way. If you think of any other way, it is fine. Because நீ போடுறதையும் உன் வீட்டில் இருக்க other children should not come and prick. But never put in your household waste. That is wrong. It's really good.
Thank you so much, ma'am. We appreciate the prompt of your response and thank you for getting back us so soon. And now we'll
Thank you all. Thank you all for your patient listening, and it was a good QA.
Thank you. And now we have reached the ending of the session. Now we invite you to witness the cultural program organized by Finance Club Nritya of our college. Dear participants, the cultural program will be held in the portico. Kindly take your seats there. And after the culture,